firstly, I would like to start with my introduction. So, yes, my name is Manpreet Kaur. I'm a clinical and a performance nutritionist. So, basically, practicing a lot with patients in my earlier, profiles, and working with them have made me realize that vitamin D is very important, and that is the reason even I was very excited to speak about vitamin D, because a nutrient which covers everything. There are very rare nutrients which cover most of your organs and take care of your most of your organs, and this is one of them. So that is why vitamin D is again one of my favorite topics to talk upon, and anything to talk upon which is regarding the nutrition has always been one of my favorite gigs, I can say. So yes, coming to your question, what is vitamin D and why is it important? So vitamin D is not just a vitamin, I would say. It's a fat soluble hormone. So why I'm calling it as a hormone? Because a hormone is something that controls everything about your body, and that is the reason I'm calling it as a fat soluble hormone. So basically, it is a fat soluble hormone which is either synthesized in our body with the sunlight or the sun rays. Either it is synthesized or either we have to ingest it if we are deficient in it. So this is the reason, why vitamin D is very important, because we have to either take it very externally or we have to just work upon getting it synthesized in our skin, which we rarely don't do. And that is the reason that you mentioned that many of the people nowadays have, vitamin D deficiency, because it is not something that comes from food. It is something that has to be either ingested or your body has to synthesize. And and the factors have to be very supportive for that. Okay, that is one thing. And considering why is it important? So basic, it absorbs the calcium. Calcium is needed for bones. That's very basic. And if the calcium is absorbed well, the bones are strong. It is important for people who are active, who are working out, for them, for the muscle maintenance and muscle strength. It supports the immunity. So immunity is one of the factors where most of the people have a compromising immunity nowadays. So vitamin D plays a very major role in that. And one thing is, it reduces a lot of inflammation in the body. So we experience a lot of inflammatory, responses that our body gives in form of either joint pain, joint stiffness. So it helps with a lot of inflammatory, as an act as an anti-inflammatory, and helps with the inflammation.
Right. Moving ahead, the next question is very simple and it is followed by the first question. See, we live in a sunny country. As I said, India is a sunny country. But why do you think there's so much of deficiency around in India?
Again, so living in a country where a lot of, we have a sun around, but then still we are deficient. The major reason is we don't take it. We don't take enough of sunlight, because at the time when there is enough of sunlight which is rich in vitamin D, we generally stay indoors, maybe in offices. So the times that are recommended is 11 a.m. to 2 p.m. So in that duration, generally we are in our offices, so we are indoors. Generally, some people have different kind of shifts. That is the reason they are indoors. People use sunscreen nowadays. That is one of the reasons that vitamin D is not absorbed by the skin and it is not synthesized. And that if not synthesized, it is not going to get processed. Pollution is one of the reasons that due to which there is a lot of deficiency seen even in the sunny countries. And again, most of the people don't expose their body parts like arms and legs to skin, to the sun. They just sit, and then only the upper portion of the body is exposed to the sunlight, and arms and legs are not that exposed. So those are the common reasons that we see that even in sunny countries there's vitamin D deficiency.
Right. And people nowadays have such a sedentary lifestyle that they don't actually care about going into sun.
Exactly.
Right, because as we know, people in the outer countries like the forest, they sit for sunbaths, and here when we have actual sunlight, they उनको stick कदर नहीं है ऐसे. That is what I feel.
Right. Here's one example. Like, if you see a small baby who's born, like 2, 3 days ka baby. So generally what happens, doctor always say there's a probable chance that we have to keep a check that there should not be, like the jaundice should not get increased. So the first remedy that they suggest is give maybe 15 to 10 minutes of sunlight on a daily basis so that the jaundice does not increase. And after maybe 5 to 10 days, they are absolutely normal. So sunlight is important from the time just any baby comes into the world. So
Right.
understand that it is important from that time. Of course, it is important for adults. Of course, it is important for any age group that we don't take. So it is very important to go in sunlight from 11 a.m. to 2 p.m. and take the enough of sunlight which helps for vitamin D absorption. And of course, avoid sunscreen at that point of time because that will not let the absorption happen.
Right. Moving ahead, what are the best dietary sources of vitamin D?
Honestly, there are no dietary sources which supply vitamin D, but yes, for some of them, if you want me to name, it is like fortified cereals or fortified milk can help with that because they are, of course, fortified. And for non vegetarians, yes, they can rely to some extent on egg yolks and fish that can help them. And of course, some of the mushrooms, maybe sun exposed mushrooms. So that is something which can be, it can help. But probably the sunlight is the biggest source of vitamin D, other than any of the food sources, I would suggest.
Okay. What are the basic or common signs and symptoms that a person has vitamin D deficiency?
Okay, so the basic symptom is the lower back pain. So that is the basic symptom that any individual can experience. Then other than that, it is like if you experience fatigue all day, lack of energy, that is one of the things. If certain person is experiencing that they are catching cold, cough, they are not recovering too fast. So immunity is compromised. That is one of the signs. So low energy, fatigue, compromise on immunity. These are signs. Lower back pain, joint stiffness, body pains. So these are some of the signs of vitamin D deficiency. Also, lack of concentration to some extent is a sign of vitamin D deficiency.
Okay. Moving ahead, you did mention few of the food sources. What all food sources help to enhance the vitamin D absorption?
Okay, so there are kind of no food sources which help absorption of vitamin D because the sources that we have do provide calcium, iron, magnesium, phosphorus, which are of course important for bone health as vitamin D. But vitamin D is something that is needed as a part of support, I would say, for all of this absorption. So there is no particular absorption, inhibitors or absorption supporters. But yes, the only thing that I can see can inhibit the absorption of vitamin D is, of course, certain kind of junk food or certain kind of, high fat percentages in the body, certain kind of chemicals which might interrupt the vitamin D absorption cycle. And of course, lack of sunlight is the major thing that I see.
Right. Moving ahead, to now we work in the fitness industry, and there's a lot about fitness performance. Does vitamin D has a role in fitness and performance?
Of course, it does have a great role. So, as I mentioned, once you are out of that deficiency zone and you are focusing on the physical activity and focusing on the bones, on the movement, so it is very important for your muscle strength. It is important for the muscle recovery or even the recovery after a 1 hour workout. A basic workout if someone is following that. For a person who is going into muscle building, for them the muscle strength, muscle recovery is very important. It helps with lower injury risk also. So people who are actually, into fitness, they have a higher chance of injury. But if their vitamin D is, going very good or the levels are maintained very beautifully, so then in that case, the injury risk is lower down to a very great extent. And of course, the energy is maintained because, of course, any kind of activity you do, you will need a certain amount of energy. So, energy for the energy maintenance as well, it is very important. And most probably, whosoever clients that I attend, I always tell them that you would be doing certain kind of liftings, you would be doing certain kind of movements. There should be no issues of injury or any kind of even soft muscle tissue injury or even any kind of the bone injury. So, it is very important that you get your reports checked before you start with the diet so that there is no vitamin deficiency at all, and especially vitamin D.
Okay, so vitamin D is very essential for the people who are focusing on performance also.
Definitely.
Okay. And I've also come across this statement that vitamin D goes hand in hand with your testosterone also. So it is very important for the males to have a good vitamin D level. So can you please put light on this?
Okay, so as I mentioned in the first question, vitamin D, I just don't call it a vitamin, but a fat soluble hormone. And most of the reproductive hormones like testosterone or, estrogen or, you call progesterone, whether a male hormone or a female hormone, for both of the hormones, the raw material is the fat. So if vitamin D is a fat soluble vitamin, it is very important that a fat soluble vitamin along with a fat soluble hormone to club and for a efficient or for a smooth hormone functioning or for a smooth maintenance of their levels. So if you see the males that are deficient in testosterone or are lacking or who are not maintaining a certain level of testosterone definitely have vitamin D deficiencies. So it supports the hormone, it supports in increasing of the testosterone, of course, along with other nutrients. But vitamin D acts as a major role because again, it's a supportive hormone for most of the functions, most of the cycle, and most importantly, it is a fat soluble hormone, which is the raw material for any kind of reproductive hormones. So it is very important to maintain the vitamin D levels.
Okay, perfect. Moving ahead, supplementation. Vitamin D supplementation is readily available in any medical store, and people nowadays do rely on vitamin D supplementations. How often should a person take vitamin D in their routine, and what is the toxicity level?
Okay. So first of all, in India, we don't see toxicity. Toxicity only happens if no if someone is taking by their own and not by a prescribed nutritionist or by a as prescribed by the doctors. That is one thing. Secondly, the ideal dosage for that is basically doctors generally give once a week for 60,000 international units. That is the standard dosage that they give. But I always give my clients the dosage depending on the levels that they have in the current scenario in their reports. That is one thing. But 1,000 to 2,000 international units per day is fair and fine enough and is generally safe. That would not cause any kind of problem. Yeah, if there are any kind of deficiencies, then in that case, the dosages have to fluctuate and not be kept as once a week.
Okay. Because if we stay in a country or if our earth gets sunlight, sunlight also has vitamin D. And I don't think half an hour अगर आप sunlight में रह रहे हो, that is going to be toxic. And if we have the same comparison for the supplementation, people should not have that belief that supplementation would cause toxicity.
Right. Supplementation never causes toxicity if taken in prescribed dosages. The toxicity happens when you go over the board and you don't realize that you have been consuming, certain amounts of dosage for a very longer period of time. So it is like 10,000 international units on a daily basis. When it crosses that, that is the level of toxicity. I don't think anyone might be taking 10,000 units, 10,000 international units per day. It is very difficult. People can take 1,000, 2,000. That is the max limit that anyone can go with vitamin D dosages. So I don't think toxicity, but yes, if anyone sees that they can have certain kind of toxicity, so they can look for certain kinds of symptoms. Like if they are facing nausea, like there is no other reason for nausea, only randomly it's an idiopathic nausea where there is no particular reason attached to it. There could be vomiting, there could be constipation.
Okay.
So these are certain symptoms that they can keep a check of if they have been taking vitamin D from a long period of time.
Okay. Everyone, please note these symptoms because if this is happening, then you need to look into it. Moving ahead, what's the best time to take the vitamin D supplement?
Okay, so the best time is generally I prescribe as post breakfast because generally breakfast is the time where we have a heavy meal and the heavy meal should be rich in the only condition that it should be rich in a good and healthy fats. So, for example, mostly people have nuts in the morning, almonds, walnuts, or any kind of nuts. So that is the best time that I prescribe. Also, the other thing to it is that that is the period that around people consume breakfast around in the range of 8 to 10 somewhere. So that is the best time when the sun is also up in the sky and your body. If you go in the sun, of course, the absorption also enhances. The absorption also increases. So these are some considerations that you need to make sure. Otherwise, post breakfast is good, and just make sure that good quality of fat is there in the fats like maybe ghee is there and nuts are there, seeds are there, that would enhance the absorption, of course. And other than that, of course, take it with the like in the sunlight. If you go post that, the absorption also increases by 2x times. So these are two factors that you can keep a note of.
Perfect. I feel these people have noted this. Moving ahead to the end, any one takeaway that everyone should remember about vitamin D?
Okay, so the only takeaway I will give is make time for yourself, go in the sun and take the sunlight at least 3 to 4 times a week if that is not happening on the daily basis, because vitamin D is not just for bones, it is for immunity as well, it is for energy as well, it is for hormones as well. And nowadays the only issue is, most common issue is with the hormones, either whether it is a male or a female. So if
Right.
you are someone, right, who wants to support your hormones, also consider vitamin D very important. So for overall vitality, the vitamin D is very much important and not just for bones. So make time for yourself at least 3 to 4 times a week. Go in the sun, sit in the sun, take certain sunlight, take on your entire body. That would help you good enough to complete that with the deficiency. And of course, supplement yourself. Keep that supplement cycle on. Do not just go off supplement for months. Keep that supplementation on with 1,000 or 2,000 international units, maybe on a daily basis or an alternate day basis.
Perfect. That's enough about vitamin D. I think we've covered everything. If you have anything that is left, we can just talk about it.
So I guess we have covered most of the things which are very basic and each one can relate to it. And I guess, yeah, most of it is covered. Thank you so much,
Perfect.
Subhashini.
Thank you so much, everyone. So this was a short episode. That is what last time also happened. Vitamins are short, simple, but important, and we need to talk about them. That's what we are doing in this nutrient series. So let's connect on next Saturday to know more about more nutrients. Thank you so much. Have a great weekend.
Thank you. Bye, everyone. Bye, Subhashini.